So, asthma is one of those chronic conditions that affects so many people all over the world. But what if managing it could be, a whole lot simpler and easier to access? Well, that's exactly what we're going to dive into today. A new plan led by pharmacists that's trying to do just that. Okay, so just picture this for a second. What if you could get expert asthma support, not just when you finally get a doctor's appointment, but right at your local community pharmacy? It's a really interesting idea, right? It could totally change how we think about managing these long-term illnesses, making care way more convenient and just part of our daily lives. And to really get why this matters, let's just talk numbers for a second. In Australia alone, a staggering 11% of the population has asthma. That's millions of people, every single one of them navigating the daily challenges of this condition. So, to tackle this big challenge, a new program is basically flipping the script on how things are done. It's called the Improved Asthma Symptom Control Program. A bit of a mouthful, I know, but the core idea is simple. It puts a super accessible health expert, your local pharmacist, right at the very heart of your care team. All right, so let's get into the nitty-gritty. What is this program's mission? Well, at its core, it's all about proactively finding people with mild to moderate asthma and giving them the tools and the support they need to really get their symptoms under control. And here's what's so smart about this whole setup, how accessible it is. You see, it's open to two main groups. You've got people who are experiencing symptoms but maybe don't have a formal diagnosis yet. And then you have folks who are already diagnosed and are just looking for better ways to manage their condition. Now, it's really important to note that this program isn't a one-size-fits-all solution. To make sure it's both safe and actually effective, it's tailored for a very specific group. So the big question is, who exactly is eligible? Yeah, getting this part right is absolutely crucial. So let's break down the specific criteria and see who this program is really for. Okay, so you might be eligible if you're between 16 and 65 years old and you either have diagnosed mild to moderate asthma or you suspect you might. But, and this is just as important, the program is also super clear about who should see a doctor first. So if you're pregnant, if you've ever been hospitalized for asthma, or if you're managing other complex conditions like COPD or diabetes, then your doctor is the right person to see. This whole distinction is really about making sure everyone gets the safest, most appropriate care for their situation. So let's say you tick all the boxes. You're eligible. What happens next? Well, it all kicks off with your first assessment. This is where you and your pharmacist really sit down and start to build out that personalized care plan. And this first visit isn't just some casual chat. It's a really well-structured three-step process. It starts with your health story, then moves to a quick checkup, and it all wraps up with a key breathing test to see how your lungs are doing. So when you're talking through your health story, one of the first things the pharmacist does is help clear up something a lot of people get confused about, the difference between asthma and COPD. A couple of big clues are when it started. Asthma usually shows up before age 20, while COPD tends to hit after 40. And then there's the nature of the symptoms. Asthma symptoms can kind of come and go, but with COPD, they tend to be much more persistent. Okay, so that third step, the breathing test, it's called spirometry. I know, it sounds super technical, but what it does is actually pretty simple. It just measures how well your lungs work. It's one of the best tools for confirming what's known as variable expiratory airflow limitation, which is just a fancy way of saying a classic sign of asthma. All right, once that assessment is done, you get to what I think is the best part, the collaborative phase. This is where you actually build your personalized asthma action plan. And this isn't some generic pamphlet they pull off a shelf. It's a dynamic plan that you create right there with your pharmacist. Now, this action plan really stands on two incredibly important pillars. On one side, you have lifestyle factors, and these are like the absolute foundation of good management. On the other side, you have a medication plan, which is a personalized, stepped approach to treatment. Both are 100% essential. So let's talk lifestyle first, because this is all about you taking control. This means figuring out your personal triggers. Is it pollen, dust, exercise, and then learning how to avoid them. It also means getting real support for things that make a huge difference, like help to quit smoking, advice on weight management, and even guidance on how to be physically active safely. Now, for the medication side of things, it uses what's called a stepped approach. The whole goal is to find the lowest possible dose that effectively controls your symptoms, not just to prescribe the strongest treatment from the get-go. A huge part of this is mastering your inhaler technique. And crucially, the plan is dynamic. It can be stepped up if you need more support, or stepped down as your control improves. But how do you actually track your progress? Well, the program uses this really simple assessment tool to measure your level of control over a 4-week period. The ultimate goal, the destination we're all aiming for, is good control. And what that means is having minimal symptoms, barely ever using a reliever inhaler, and having absolutely no limitations on your daily activities. But remember, building the plan is just the beginning. It is not the finish line. The final, crucial piece of this whole puzzle is the ongoing management. It's all about staying well with asthma for the long term. And what this does is create this fantastic, continuous loop of care. You'll have regular reviews with your pharmacist to make sure your symptom control and inhaler techniques stay on track. Your action plan becomes a living document, updated whenever it needs to be. And maybe, most importantly, your pharmacist works directly with your doctor, making sure everyone is on the same page, creating a fully coordinated care team. You know, there's a quote from the official protocol that just nails it. It really sums up the whole philosophy. The ultimate goal isn't just to treat asthma. It's to relieve and control symptoms, prevent those scary flare-ups, and, at the end of the day, improve and maintain not just your lung function, but your entire quality of life. So what we're looking at here is a model for care that's so much more accessible, more personalized, and more proactive, all by using the experts we already have right in our own communities. And it leaves us with a really powerful question. If this works for asthma, could this be the future for managing all chronic conditions?